A time that I made a mistake was also during my externship. I was instructed to get a lab sample from a PIC line, which I had never done before. So my preceptor came in the room with me and she gave me the supplies and I started drawing the samples. But I didn't know that you had to waste the first sample. So we just went directly into getting the samples and then my preceptor let me know, oh no, like we need to waste a sample. And wasn't sure why. And she explained to me that the lab sample can be diluted just because you do flush it before. And in return, the results will be messed up. And then the patient's plan of care could be affected because of that. So that first vial that we drew had to be discarded. And we grabbed another vial and got a new sample because of that and sent it down. And from that, I have learned how to correctly get a sample and how important that is because the patient's entire plan of care could be altered if the lab results were wrong.
You could also say you make sure that you look at the policy and procedure and make sure there's no little part that you're missing
Okay.
you need to be aware of. Yeah, I like this one. I've never heard this one either, which will be kind of nice for them. What if they ask you about a time that you made a mistake?
A time I made a mistake during clinical was I remember having this patient who we had to draw frequent labs, and I went to go get labs for this patient. It was just a metabolic panel, and I remember this day I was overwhelmed with tasks, and as a student, I was still trying to find that balance between getting everything that I needed to do on time done and my time management skills just needed some work at this point in time. And so basically, I drew the labs and I labeled them and put them in the bag, but then I stuck them in my scrubs pocket because I said I would go drop them off on my way out. And lo and behold, like an hour had passed, maybe more, and I was looking like, where's the lab results? Because usually they came in pretty quick. And I realized I had never even dropped off the labs. They were still in my pocket because I got sidetracked with other tasks and never finished that task that I began. So, this was a great learning experience for me because it really made me become aware of the fact that as a new grad and as a student at that time, I really am not going to have the experience to multitask so much, and that I'm going to have to get used to that and gain that experience over time. So it's very important for me as I'm stepping into this role to take one task at a time and really actually follow through with what I'm doing before trying to move on to the next thing. So ever since then, I've made it a point to not put anything in my scrubs pocket because I don't want to risk forgetting about it. And if that had been a critical lab or the lab that expired and then I needed to redraw, that would have been a waste of resources and could have been like a potentially more serious situation. So it definitely opened my eyes to staying on task and finishing the task that I start.
It's funny because you just seem so, I just can't, it just doesn't seem to fit with,
I know, right? Well, then,
um,
like, is it okay to say that then, or do you think that that's going to throw them off of their image of me if I'm like, I was disorganized and spaced out?
you could maybe even say that you're like, what did your preceptor think? Did she think it was funny knowing you? Because it's not
She
something you.
thought yes, that's actually the exact reaction I got. Is she kind of like giggled because she was like, she knows that I'm like very um I don't want to use the word perfectionist because I think that that comes off as a weakness, but like she knows that I'm very organized and
Like
on top of
diligent.
it. And so yeah, diligent, that's a good word. Like she knows that I'm very diligent and like always follow through with everything. So that she was also kind of laughing that like, oh, you forgot. And I was like,
I think you should say, I apologize to my preceptor. I couldn't believe that I did that. And
is it
she
so out of
laughed.
character or something? Yeah.
She actually laughed because she knows that I'm typically very diligent,
Okay.
and am on top of everything, is what she said, that she just thought
Hmm.
it was funny that
Yeah.
she
Okay.
seemed to not fit with
Yeah, it doesn't.
not
I was
something that
like,
I would do.
that's why I was so horrified because I was like, I feel like I hold myself to this standard of I'm so organized. And then I was like, I can't believe I actually forgot to drop off the labs that were in my pocket this whole time. Like,
Maybe express that through her eyes or through her what she
okay,
said, just
okay,
in your defense, right? That you're
got it.
so that they know you're not like a space cadet, that you
Sure.
basically like
Yeah.
the reason it was funny to her is because that's not you at all.
Yeah.
She knows that you're
Okay.
just like it's your first day having two patients and you're working really hard and just
Hmm.
Just forgot
Okay.
something. I wonder if it would be worth starting with that when they say, tell
Mm.
us about a time you made a mistake. Maybe you could say, there was a time that I made a very embarrassing mistake. My preceptor actually thought it was very funny because
Okay.
she said she's always known me to be very on top of things and diligent. So she
Hmm.
kind of got a kick out of it, but I was horrified.
Yeah.
I cannot believe that I did this. What
Okay.
happened was, and then like goes,
Okay, I like that. Yeah,
yeah,
that's actually cool. I think that they would
yeah,
appreciate that because I'm kind of like making, I mean, like it wasn't a super dire situation or anything. So like, yeah, I think that would be the time to kind of
yeah.
put some humor in it.
Yeah.
Okay.
Um, if you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview. They might ask, tell us about a time that you made a mistake and how you took accountability for it and made changes.
Yeah, okay. So this happened during my rotation as well. I was instructed to do a blood sample and a urine sample on a patient who we just admitted. And after completing the urine sample and the specimen collection, I put it into the collection tray. But what I had forgotten was that I did not put labels on any of them, so it just was blank. And when the lab took it back, they called saying we have a unlabeled specimen here and we're not sure whose this belongs to. And it took me a little while to figure out that was my patient because the nurse was like, the value the like the lab should have came back by now. Like he's been here for an hour. And that's when I told, like at that point I admitted to the nurse, like I honestly think that was my fault. Like I take full accountability for it. And I think just a learning moment from that was to really, before I do anything, just to really gather all my materials and make sure that, I'm doing it on the right patient because I could have jeopardized that could have not been the right patient at all. So just moving forward, I really learned to really be attentive to detail and making sure that before I do anything, just have everything in my hand so I don't forget it in the future.
Yeah, attentive to detail. And then you could talk about how it caused a delay in care.
Some of the nurses, like, I think they crack jokes at the end. At the end of the day, they're like, "Oh, don't forget to put a label on this one too." So like,
Yeah.
'cause I think my nurse laughed. She's like, "Oh, don't worry, I made that mistake when I
Oh, yeah.
started." So
Yeah.
I think it's a very common mistake, especially like in where it's such a fast-paced environment. Like I think the small things like that are easily forgettable.
Yeah,
She
I
said,
think everyone is at least once.
"Yeah,
And it's better than putting like the wrong, like what if putting like a label for the wrong patient or something.
yeah." Totally.
Okay, cool. So